These days, we know that testing for COVID-19 is a topic on the mind of many in our community. We get a lot of great questions: who, when, how. Here are some answers to the most common questions.
Who can get tested?
Currently, testing is available to people showing symptoms of COVID-19, people who've been exposed to COVID-19, and all essential workers. And by this, we mean anyone who has been working during the pandemic in a job that involves frequent interaction with the public: grocery store employees, gas station attendants, construction workers, healthcare facility workers, and adult or child care providers, among others. Mostly we are testing adults, but in some instances we can test children as well.
Where can people get tested?
There are a few different options. Most healthcare providers offer testing to patients who meet testing criteria. Anyone needing testing can start by reaching out to their primary care provider. There are multiple testing options countywide. If you are not able to obtain testing through your medical provider, free confidential testing is available in Marin and the Bay Area. There is a website where you can search for your nearest testing location by zip code. Visit the website on the screen and look under the Where to Get Tested section to find the link to the search tool. A dedicated testing site is also available in San Rafael for people who are uninsured, underinsured, undocumented, or homeless. Make an appointment at lhi.care/COVID testing. If you don't have internet access, you can call 1-888-634-1123. The website and hotline are both available in multiple languages. If you have medical insurance, the testing provider will bill your insurance company. Tests for uninsured individuals will be paid for by the state of California.
Is it confidential?
Yes, it is confidential. Your personal information will not be shared.
Is it free?
Yes, it is free.
Do I need health insurance?
No, health insurance is not required to get tested.
Why should I get tested if I don't have symptoms?
Even people without symptoms can have COVID-19 and give it to others. It's important to get tested to help protect the people who you live, work, and interact with so they don't get the virus. For adults over 65 and people with certain health conditions, being exposed to COVID-19 could be deadly. Testing is one of the best ways to protect our community and our loved ones from getting sick or dying from COVID-19. In addition, if you live in a community where many people live together in a single house or apartment, with several generations in one household, you are at highest risk of getting the virus and spreading it to others.
Do I have to get tested?
No, testing is voluntary. We do recommend that you get tested if you are experiencing symptoms, have worked at all during this pandemic, whether at a grocery store, gas station, in construction, or at another job where you've had regular interactions with people outside your household, and/or if you've been in close contact with someone who has or had COVID-19.
What is it like to get tested?
A nasal swab made of cotton is inserted into your nose to collect the sample. It can be uncomfortable for a moment.
If I am sick, where can I get care?
Your regular healthcare provider will see you if you have one. In addition, Marin Community Clinics offers phone and in-person appointments. You can call them at 415-448-1500.
Can children accompany parents to testing appointments?
We recommend leaving your children at home in the care of another adult. If you have no other option, you are welcome to bring your child.
What languages do the staff at the testing location speak?
It depends on the testing site, but often staff are available to help English and Spanish speaking community members. Additional language translation services may be available with advance request.
Will I need to fill out paperwork? Will someone be able to assist me with it?
We will have a few questions for you to answer. Mainly, we need to know how to contact you when your test results are ready. This is done on a computer and someone will be able to help you.
How do I get my test results? What if I test positive?
It may vary slightly based on where you're getting tested, but generally speaking, you'll get negative test results by email. If your test comes back positive, a doctor or nurse will call you. They will give you instructions for how to protect yourself and anyone else living in your household.
What resources are there if I test positive?
There is support available depending on your circumstances.
How long does it take to recover? What does it mean to be recovered?
Individuals without symptoms who get a positive test result will need to isolate for 10 days. It takes at least 10 days of isolation and 72 hours without symptoms to be considered recovered.
Can my landlord evict me if I am sick?
No, that would be discrimination.
As the family member, roommate, or coworker of a COVID-19 positive person, what do I need to know?
Anyone who is in close contact or thinks they have been exposed to someone who tests positive for COVID-19 should get tested as soon as possible. For those who will be sharing the same household and are able to quarantine at home, Marin County Public Health staff can provide advice on how to stay safe and how long to stay home. Once someone is recovered, if the rest of the household contacts are negative, it is safe for the person to return home if they quarantined elsewhere and/or resume normal household activities. For more information on testing, please visit our testing information website. For more information on our general response to COVID-19 and other frequently asked questions, visit coronavirus.marinhhs.org. Stay healthy, Marin.